Welcome to our next interview. We are here today at Health Information Management Systems. This is a local company close to downtown Tucson, and they specialize in electronic health records. They moved to this building about 8 months ago, and you can see it's a very nice modern building. They have an arcade machine, so that's very important when you work here. We're here today to interview the CEO of the company, and he'll talk to us about his company, some of the products, and he'll give us a demonstration of the electronic health records that they sell. So we're here to interview and to talk to Khalid Al-Maskari. He is the CEO of Health Information Management Systems, and he'll talk to us a little bit about the company and more about electronic health records. So Khalid, can you start by telling us how you started this company and how you grew the company, what your initial idea was? How did that go?
Sure. When I graduated from the University of Arizona, I started working as the Management Information Systems Director for a local Tucson-based behavioral health organization. During that time, I got to talk and become friends with a lot of clinicians in the industry. The biggest issue that they had was how difficult it was for them to use their electronic health record. And I started asking a lot of questions, trying to find out what are the problem points, what are the things that they have difficulty with. After asking the questions, I started looking for other EHRs, thinking that there may be another EHR that would solve those issues. At the time, unfortunately, I could not find another EHR that was focused on what the clinicians need. The way that EHRs were introduced back in the late 60s and the early 70s, it was more to fulfill a process which is moving from paper to electronic, but it was not designed with the clinician in mind. So we spent a few months asking questions, collecting the data, figuring out what is it that will work from a clinician's point of view. And that's how we started. We actually started in the basement of the company that I was at. It took us a few trials, and then we came up with a version 1 of the software, and we've been refining it since then.
So how many people do work here now? How many products do you have?
We have 2 locations, one in Tucson, which is here, and one in Phoenix. We have about 50 employees and growing. We're always looking for developers, project managers, and clinical staff as well. And we hire, unlike other EHRs, we have clinicians that work for the company.
So you mentioned you started by talking and being friends with people in behavioral health.
Right.
So this is different from, I know this is different from mainstream medicine maybe, but does it also affect the electronic health records? Are they different too?
It absolutely does. Behavioral health has a lot more requirements than physical health. There are a lot of...
What do you mean? What kind of requirements?
They have certain requirements where this either a state mandates or legal court systems mandate a lot more assessments. The patients for behavioral health, they're not patients most of the time. They're reoccurring issues that they're working with. So there's a lot more coordination than going to a PCP and asking for a solution for a specific issue. The interesting thing is that behavioral health and physical health, they've been separate for many years. About 8 years ago, there was a mandate to integrate them. So we started the integration process, which is another phase of the software, trying to make sure that when a patient talks to their psychiatrist, they're also able to talk to their PCP in the same setting. The challenge with the EHRs, the way that they were built, they were either behavioral health EHRs or physical EHRs. So what we did with our product Axiom is we integrated the two. So now it could be a PCP who's also viewing the information for the same patient with their other behavioral issues.
So what are some of the components that are common to, let's say, all EHR? And what are some components that are really specific to behavioral health, or maybe another subdiscipline?
Sure. So with behavioral health, there are a lot of assessment tools. There's assessments for substance abuse assessments, drug screening, there are behavioral health assessments, and then there are treatment plans. So treatment plans are long-term treatment plans. Each patient that comes in to see their psychiatrist or behavioral health counselors, they have to go through that process. In a physical setting, a medical setting, you don't have that. the support around the patient is a lot stronger with the behavioral health because of the needs of that population. And the time that it takes to provide all those services is also a lot more than working with the physical and medical health.
What about interoperability? Now that you say you're starting to combine electronic health records,
right?
Is that a headache, or is it going smoothly, or major
It's
problem?
very interesting. So each state has a health information exchange. Arizona has one too. The idea for the HIE is to try and get the information together. Unfortunately, there are a lot of difficulties with that, and I know that they're working on streamlining that process. It's been a challenge to combine the data and get it in a place where the right people see the things that they need to see at the time when they're working with the patients. But it has improved. There's still a lot of ways to get it.
Okay. I was going to ask you what is so specific about your software, but we have a demo ready, right?
Yeah,
so
absolutely.
Maybe you can show us.
I would love to. The product that we have three product lines. We have the EHR, desktop EHR. We also have mobile suites, Axiom mobile suite, and then a patient portal. This is the EHR, where a lot of the information we're trying to provide different information based on the role for the user. This is general information about services provided, units, and cost over a specific date range.
So is this for one patient, or?
No, this is actually for the entire agency. For the agency itself, the number of services that they provided, like a dashboard of the number of
and an
patients
agency
they
would
have.
be like a customer of yours with multiple patients?
Exactly. So an agency would consist of doctors, nurses, case managers, care coordinators, and therapists.
Okay.
And this is the overall dashboard and the KPIs for that company. There are different types of compliance measures like we've discussed earlier. So with integrated care, there's more compliance requirements that we show in here. A snapshot of the information, whether it's looking at a specific month or for the entire year. We also try to dig a little bit deeper into the information. This is a part of Axiom, is the ability to go a little bit more into the data. So if you want to know the percentage of the services that are provided, and then within that, the staff that provided that service, and you have this ability to get those key performance indicators in every single metric that you're looking at. One of the things that we're doing also is we're looking at the words that are being used most commonly in settings and trying to figure out what makes sense. So as an agency, each agency that we work with, they have different sets of treatment modalities and best practices, and they use this to see what are the things that are common that are being discussed with all of their patients. So there are a lot of metrics that we keep, enrollments and different types of population and gender. Some of the integrated stuff talks about value-based purchasing. We have that information as well. We also do more with the financial analytics. So as you know, with healthcare, the costs are always an issue. So people try and manage cost. Medicaid in Arizona is the Arizona Healthcare Cost Containment System. So looking at it from perspective of, are we providing the best services and receiving the outcomes that are needed to make sure that we're providing those services. So some of the stuff that we have is, again, everything we do is customizable in terms of the date range, so you could select different dates, and then the type of services and the percentages, medical versus support versus rehab services. And same thing in here, you could dig a little bit deeper into this information. So the analytics is something that we've built into the product rather than going and looking at some of the products out there that may not integrate really well with the customer and with the specific items that they're looking
So is this common for EHR systems to give this kind of overview?
A lot of EHRs actually, they do the function of being a resource, a repository for entering data, but not necessarily the analytics. Some of them purchase third-party tools to integrate with it. The way that we're working at HIMS is that we want to provide the tools because we know our customers. A lot of it is working with the customer specifically, asking those questions again, and then synthesizes them in a way that makes sense for everybody.
Okay.
So with the analytics, there are clinical, administrative, and financial analytics there. But I'll go ahead and jump into the prescription module. One of the things we try to do is make it very user friendly. So the interface that we have is something that works really well with mobile devices, plus the customization of the product itself, which is a key for what we do. In here, we do look at how long does it take to provide a specific function. The number of clicks is really important when you have 15 to 20 minutes to provide a service. We're constantly trying to look at it and determine how could we reduce those clicks, how could we do things a little bit better, a little bit faster. So an example of this, if you want to change a medication or to renew a medication, it's really easy. Just by clicking this medication, it automatically knows that you will be refilling it. If you wanted to change another medication, you could come in here and change the dose. The dose is right there. The interface is easy to use. The instructions are right here, so you're able to see and determine what it is that this screen does. If you want to undo something, it's pretty simple. You click on it to say, I want to undo it, and you're done with that. So also adding medications, we try to make it really easy. So instead of having to type and click, we identified the common things that are being done by the users of our system. And for each screen we try to anticipate those common areas that they do. So if you select a medication, for example, and you click on it, it'll automatically fill out the information for you. And it'll tell you the items that are missing, so you could go ahead and change that information. And the ability to add it, so it reduces the administrative time for doing stuff like that. As far as writing notes and collecting information, it's another thing that we try to automate, reduce, and adapt to our users. So the way that it works, it automatically starts the note with starting the note, and then with all of the information that's there, the amount of time that it takes to look at a record is immense. So what we try to do is categorize it into the areas that the clinician needs to look at. For example, a chief complaint, if you want to look at all the chief complaints since the patient has been with the agency, you'll be able to see all that information here. If you wanted to pick up some of the information, you could click on one of them and it automatically fills it out. What we do is we also use analytics and data mining to determine what are the common things that are being used for each one of these boxes in here, and this changes based on the things that are being selected most commonly.
So are you capturing data while it's being used so you can optimize your interface?
Absolutely. So what we're doing in the back end is that we have over 5,000 users of the system, and what we do is we provide those services automatically. As the data comes in, the mining happens, and this changes based on not just the agency, but the user themselves. So looking at the roles that they're providing. With a lot of the screens, we try to make it easier for the user, so you're able to select information, templates. You could modify all of this information in here with a click of a mouse. With a lot of EHRs, when you want a change to happen, it may take 2 to 3 to 6 months because there are a lot of people that have to go through project management, requirement gathering, and other things. What we try to do is basically say, we're not going to do that. We're just going to make it where you, the user, are able to make those changes, provided that you have the security and the administrative rights to it. So you would be able to select any of the notes and then change any of the values for those notes. So for example, if you go to a note in here, it'll give you the information for all the fields in that note. If you edit it, you could edit the note, you could add, you could sort the information the way you want it sorted, and the minute that you're done with it, it actually applies to the form itself. So again, we're reducing that. The biggest pain point for EHRs is the amount of time it takes, how slow it is, and then the constant change that happens that nobody is able to manage. Some of the other things that we try to do as a company that's focused on user experience is provide the users with the tool that they need to create the documents that they want to create at the time when they need to get it done. Again, we are looking at ourselves as a company that provides the tools for our users and remove ourselves from that equation. So this is a dynamic form builder where you're able to create a form within 20 minutes, and the form could be as sophisticated as having tables and check boxes. When you click on some of these, you could determine whether something is required or not. You determine what type of alignment and then the type of information that's there. We also set it up in such a way that once you're done with it as a user, then it will apply to the entire agency. So it moves creating forms from 1 month to 6 months, past possibly longer, to literally within the same day, and it's applied to the entire agency. Another thing we did when saving the notes, and this is creating a global repository for our customers. So we have a lot of users that use the software. Instead of each agency and user creating their own form, they could share it with the community. So if I click on Use a Global Repository, this is basically a permission from me, the user who created this form, for anybody else at any other agency that uses our product HIMS to utilize that form. And hopefully with that, it reduces the amount of time. It also encourages some of the collaboration that is missing currently from in my opinion, the integrated healthcare sector. Last thing I'd like to show is probably the ability for finding the information. So we look at information in terms of what is it that you need to know at the time that you're working with the patient. You have your appointments and you have these alerts. So the alerts would be any labs that came in, notifications from other clinicians, scanned documents, and other type of notifications that we add in the system. There are also notifications based on each patient, if there are assessments that need to be done, or if there are other alerts that need to be discussed with the patient. So we tried with the software, we really tried to make it where it's focused on the user, and the user would be focusing on the patient rather than the EHR being the biggest obstacle for providing care.
And before we conclude, do you have a trial version or something? If anybody is interested, they can try out or have a look at online?
Absolutely. So the website is hmsfirst.com, and we have information about all the products that we have, the mobile suite, and then information about how to demoing the system or trying the system.
And you got some beautiful pictures on there too.
Exactly. Thank you.
Well, thank you for the demo. That was very informative. Thank you very much.
You're very welcome.